Hello, Dr. Jeff Johnston here. Today I would like to talk about the different specialties within dentistry. I myself am a general dentist, so a general dentist is licensed to pretty much do anything in dentistry that he or she is capable of doing it at a specialist level. Now, what is a dental specialist? Dental specialist is, if we compare it to our medical counterparts, we have there's a cardiologist, and then there's a family physician, there's a pediatric medicine. Um, Medicine's broken up into a lot of specialties. Dentistry also has those specialties. There are a few specialties in dentistry that I'd like to talk about and explain. Number one is the endodontist. An endodontist does root canals, and they deal with things that are like nerves inside the teeth and root canals, things like that. An endodontist works under a very high powerful microscope for the most part, and they do things. They have 3 or 4 years of education that a general dentist doesn't have, just in root canals. Uh, Another specialty is a periodontist. A periodontist deals with the gums, the bone, the support around the teeth, um, and they deal with you know gum surgeries, grafting, uh, root coverage on teeth, things like that. And they go to school 3 or 4 years after general dentist just to become a periodontist. Another specialty is an oral surgeon. Oral surgeons do wisdom teeth extractions, they do jaw surgeries, they go into hospitals, tumor removals, they can do plastic surgery, they do dental implants. And oral surgeons go to school maybe 6 years after, probably 6 years or 7 years after general dentist to be an oral surgeon. Some of these guys have to go finish their medical degrees as well, so they're MDs as well. Next specialist is prosthodontist. A prosthodontist is someone who specializes in full mouth rehabilitations. They specialize in doing extreme cases of bite relationships, crowns, anything to do with a prosthesis in your mouth. A prosthodontist specializes in. Another specialty is a pedodontist. A pedodontist specializes in children's care, usually anything under 10 years old. They do a lot with baby teeth. They can go into hospitals and do sedations, and help kids out. Some of the things that are not specialties are cosmetic dentist. There is no cosmetic dental specialty at this point in time. There's no TMJ, TMD specialist for your jaw joints. Those are two specialties that just aren't out there. There's also not an implantologist specialty yet. So there's a few specialties out there that people have perceived in their mind that they are a specialist, but they're just not specialists in those fields. Now, general dentists can take their offices in any way they want. If a general dentist wants to go take a lot of training in root canals, and do the things that the endodontists do and gear their practice that way, we can do that as general dentist. Some things I'm specializing in is the CEREC crowns and bridges. I'm going into the implant world. I'm doing a lot of restorative type work. Um, so those are kind of the specialists. Implants, there's endodontists getting into implants. There's periodontists that do implants. Oral surgeons do implants. Oral surgeons and periodontists are your main implant specialists. General dentists, more and more general dentists are getting into the surgical aspect of implant dentistry. So there's a lot of definitions out there of what each doctor is and what each dentist is. Now, I personally believe in utilizing specialists when they're needed. I'm not the kind of doctor who wants to do everything. If a specialist can do a root canal better than I can on that tooth, I send people over and utilize the specialist because I want them to have the best care possible. And a lot of people say, well, you can't do that root canal. I can do the root canal. I'm not doing the root canal under a microscope, and I'm not doing things that specialists have special tools for. I would much prefer someone go get their heart surgery done by a cardiologist over a family doctor. So those are some points I'd like to make about my office. I do utilize the specialist as they are needed. Some cases I see have multiple specialists. They go to the orthodontist, and then they'll go to the periodontist. Some things take multiple specialists. Um, there's dentists out there that just do it all. To what level, extent are they doing it all? Are they doing a job equivalent to a specialist? It's hard to tell. But I do like to utilize the specialist. So, in review, we've got the orthodontist, which is braces, periodontist, which is gums, pedodontist, which is a children's dentist, an endodontist, which is a root canal specialist, a prosthodontist, which is anything with prosthesis, dentures, crowns, anything like that, and an oral surgeon. Those are your specialties in the dental world. A lot of people get lost in those definitions, so I just wanted to review that with you guys today. We'll see you next week. Thanks. Bye-bye.